Texas breaking new records today as coronavirus cases continue to grow across the state. Doctors across Texas told KVUE's Mike Marute the surge we're seeing now is worse than the one we saw this summer. Good evening, Mike.
Good evening, Jenny. Now, data shows that we are at a tipping point, according to experts from across the country. And doctors told me today, if we don't change our behaviors, we could be worse off as we start 2021. Thanksgiving's right around the corner, and COVID-19 cases across Texas are trending in the wrong direction.
The pump has been primed, and now we're putting our foot on the gas.
Saturday, the state recorded its highest daily new cases number since the pandemic started, 12,597. But that's not the most important metric doctors keep an eye on.
Really, the situation on the ground as it affects the healthcare community and the degree of severity of illness for our patients are those that are needing to be hospitalized and ultimately admitted to the ICU.
Thursday, Austin hospitals said 21% of their beds were available and 15% of ICU beds were open.
I have to give kudos to our hospitals. They're doing really a phenomenal job. They're busy, but they're not at capacity.
The spike we see now is a whole lot different than what we saw in June and July.
In the summer, we still had generally a favorable capacity in our healthcare systems. Now, we're hit hard across the state.
The spike is nationwide, and everybody's needed where they are. It's going to be very difficult to find people that you can pull from somewhere else.
Going into Thanksgiving and the holiday season, most Texas counties are at high risk for spread, according to Brown University researchers.
If behavior doesn't change over the next several weeks, by the time we get into January, it could be really, really scary.
What does really, really scary mean for you?
So it means that there aren't enough nurses and doctors to take care of all the sick people that are in the hospital. And then it means that there aren't enough beds in the hospital to care for those patients.